Are you tired of hearing about COVID-19, yet people around you still keep getting sick? Many of us are making daily mistakes that quietly increase our risk. Briefly explain COVID-19 as a respiratory virus that spreads mainly through droplets and small particles in the air, causing illness that ranges from mild cold-like symptoms to severe pneumonia and complications. What is COVID-19 in 2025? Clarify that COVID-19 has become an ongoing respiratory infection with waves and new variants, not gone, especially risky for older adults and people with conditions like heart disease, diabetes, lung disease, and weakened immunity. Mention common symptoms: fever, cough, sore throat, runny nose, loss of smell, fatigue, breathing difficulty. And note that some people develop long-lasting symptoms called long COVID. Risky mistakes you must avoid. Present as top 8 COVID-19 mistakes putting you and your family at risk. Skipping or delaying vaccination. Not staying up to date with COVID-19 vaccines increases the risk of severe illness, hospitalization, and death, especially in high-risk groups. Encourage viewers to follow local guidance for the latest annual or updated vaccine and to discuss questions with their doctor, especially if they have chronic conditions. Ignoring symptoms and still go into work, school, social events, or travel while having fever, cough, sore throat, or other respiratory symptoms increases spread. Emphasize staying home when sick, testing promptly when possible, and following local isolation. Return to activities advice instead of pushing through crowded indoor spaces with poor ventilation. Spending long periods in crowded indoor settings, parties, bars, busy gatherings without precautions raises infection risk because the virus builds up in the air. Suggest choosing outdoor or well-ventilated venues, keeping some distance where possible, and limiting time in tightly packed rooms. Not using masks when needed in crowded indoor spaces, on public transport, or around high-risk people. Not wearing a well-fitted mask removes an important layer of protection. Explain that good masks, such as well-fitted medical or respirator-type masks, help reduce the chance of inhaling or spreading infectious particles, especially when distancing is difficult. Poor hand and respiratory hygiene, touching eyes, nose, and mouth with unwashed hands, and coughing or sneezing into open air or hands helps spread respiratory viruses, including COVID-19. Encourage frequent hand washing with soap and water for at least 20 seconds or using alcohol-based sanitizer, plus covering cough and sneezes with tissue or elbow. Forgetting about clean air and surfaces, never opening windows, ignoring ventilation, and rarely cleaning high-touch surfaces can allow viral particles and germs to accumulate indoors. Simple actions like opening windows, using fans or air cleaners, and regularly disinfecting frequently touched objects, phones, door handles, switches. Lower risk. High-risk social behaviors, frequently attending large gatherings where people are close together, eating and shouting without precautions, increases exposure potential. Encourage viewers to think about who they might bring the virus home to: elderly parents, people with chronic disease, and to balance social life with protective habits like masking and better ventilation. Ignoring high-risk conditions and late treatment. People over 50 or with conditions such as chronic lung disease, heart disease, obesity, diabetes, kidney disease, or weakened immunity have higher risk of severe COVID-19 and should not ignore early symptoms. Advise high-risk viewers to seek medical advice promptly about testing and antiviral treatments, which work best when started early in the illness. Positive protective habits. Summarize protective pillars: stay up to date on vaccines, stay home when sick, use masks, and good ventilation in high-risk settings, keep hands clean, and protect medically vulnerable people. Encourage healthy lifestyle choices: no smoking, regular exercise, enough sleep, managing chronic diseases because general health also influences how the body responds to infections. If this video gave you clarity or hope, please like this video, share it with your family and friends, and subscribe to Medickpidia for more science-based, heart-touching health content. Together, let's turn awareness into protection and protection into hope for every patient and every family.